With this week's Cardiology Countdown, we'll begin with the stock market. The investigators at Duke looked in the Duke database of patients undergoing angiography and found that the rate of MI increased as the stock market fell. They observed this over the period of 2006 to 2009 and focused in particular on the stock market crash that was between October of 2008 and April of 2009, where they saw a significant increase in the risk of MI, and that was true even after adjusting for other confounding factors. It's certainly something that we've heard about with individual acute stresses such as earthquakes, Scud missiles, or losing a Super Bowl, but now a more chronic one seeming to relate to an increase in heart attack risk. The good news, of course, is that the stock market has been rising lately and the rate of MI has been falling in their more recent data. Now, at this week's number 2 spot is a study that's a collaborative meta-analysis. Our group was part of it, looking at Clopidogrel and the 2C19 reduced function alleles. This has been a hot topic, in part because the FDA has added a black box warning about reduced function poor metabolizers, that is homozygotes for the 2C19 reduced function alleles, warning of reduced effectiveness. So this collaborative meta-analysis looked at the question of whether the risk is present if you have just one allele or whether both alleles are necessary for the increased risk. What was seen in this observational study was that even just one reduced function allele was associated with an increased risk, but there was a dose response with a higher risk seen with 2 reduced function alleles. Now, the other thing is that these studies identifying the risk have been seen in patients largely with acute coronary syndromes undergoing PCI, which would be the highest risk group and those at risk of stent thrombosis. And so the notion is that that may be the group where this is most important. Recently, there have been data published from the CURE trial that had a minority of patients undergoing PCI where the 2C19 reduced function allele, either heterozygotes or homozygotes, was not that important a factor. And so certainly more evolving information in this field. And this week's top pick is a study that looked at Warfarin discontinuation. We've talked a lot about, and many studies with Clopidogrel discontinuation, but Warfarin discontinuation in atrial fibrillation may be just as serious with an increase in stroke risk. And so out of a database from Kaiser Permanente with over 13,500 individuals followed for about 6 years, they found that 1 in 4 patients discontinued their Warfarin. Many of them were low-risk patients and younger patients, and so they couldn't tell but thought that perhaps they were low enough risk, felt that it was safe for them to discontinue. But they did note that many of these may have been inappropriate discontinuations in that those who had poor INR control were one of the predictors of an increased chance of stopping medication. And so this ties into the whole issue of medication compliance that we need to work with our patients for all medications, and also does touch upon the recent approval this past week of an alternate agent, dabigatran or dabigatran, which is an agent that does not require INR monitoring, and we'll have to see how that plays out as it is approved in clinical practice as to whether that could be a way to improve compliance with oral anticoagulation. So with this week's Cardiology Countdown, I'm Chris Cannon.